If your patient has incompressible arteries or an ABI greater than 1.4, the TBI exam can be used to further examine limb perfusion. This condition can occur in patients with diabetes. The TBI exam is used to determine the toe brachial index. Begin by selecting the TBI exam from the File menu. Wrap the arm cuff as was done in the ABI section. Place a small digit cuff on the great toe and the PPG sensor distal to the cuff. You must be able to get a PPG pulse in order to obtain a toe pressure. You can obtain a toe pressure with a Doppler, but it is more difficult as the digit arterial signal is not easy to obtain. Fill in patient information, current symptoms, risk factors, ICD codes, etc. on the report. Use the computer cursor and click on right brachial site. Place the Doppler probe at an angle to the skin over the radial artery. Move the probe slowly back and forth until the strongest arterial signal is heard. While listening to the arterial blood flow, inflate the cuff with the aneroid until you no longer hear the signal and continue for an additional 20 millimeters. With the release button, slowly deflate at approximately 2 millimeters per second. When you hear the Doppler signal return, note the pressure on the aneroid gauge and enter it in the right brachial field. If you want to repeat the pressure measurement, simply repeat the process. When satisfied, use the cursor to move to the next site or press the Tab button to move to the right toe. Inflate the cuff with the aneroid until you no longer hear the signal and continue for an additional 20 millimeters. With the release button, slowly deflate at approximately 2 millimeters per second. When you hear the PPG signal return, note the pressure on the aneroid gauge and enter it in the right toe field. If you want to repeat the pressure measurement, simply repeat the process. To obtain a PVR waveform at the ankle cuff, press the right PVR button on the computer screen located under the right ABI index. A pop-up will appear with a visual gauge of appropriate pressure. Inflate the cuff to approximately 80 millimeters and deflate to 65 millimeters. This slight overinflation helps to release wrinkles in the cuff and take a more stable PVR waveform. The gauge being in the middle is 65 millimeters, and the recommended pressure to take the PVR waveform. Please note, you may take a PVR waveform as long as the visual gauge is neither completely empty nor completely full. It is not necessary for the pressure to be exactly 65 millimeters. Press the Get Waveform button to take 5 seconds of data. If you want, you may repeat to collect 5 seconds of data. It will overwrite the previous waveform. If satisfied, deflate the cuff and move the aneroid to the left arm and press Tab or use the cursor to move to the left brachial site on the computer. Repeat on the left side. When finished, save the report.